And we're very excited for the next part of our program this morning. The beginning, we were talking about, now I'm the new PD. Now what? So now we figure that part out. Now is where we get kind of to the fun and challenging stuff. So for the bottom part of this hour, we're talking about potential challenges as a PD. And we broke it down from, within your division, with other specialties, maybe with trainees, and certainly some of the financial stuff as well. So my pleasure to introduce Dr. Brown, Kellie from Medical College of Wisconsin. She's going to talk to us a little bit about potential challenges that you may encounter as a PD dealing with people within the division and section. Thank you.
Thanks, JJ. So thanks. I'll talk about the challenges within the division, specifically what to do with difficult faculty and how to ensure some protected time. I don't know that I have specific answers for all of these that are 100% foolproof, but I have some suggestions. And my disclosures, I have no financial disclosures, but I am a fellowship program director, so any references to fellows is also meant to include residents. Sometimes I don't, sometimes I'm not as inclusive as I need to be. And so let's start by talking about difficult faculty. Faculty are the foundation upon which a program is built. And a lot of how you handle issues or problems within your faculty come from the program requirements. And when you're first starting a program or first starting to be a program director, you may view these program requirements as being onerous or being difficult or something that you have to meet. But they can also be very, very helpful. They can give you the authority that you need in certain situations. And that's how, in these two particular situations, how I would view the program requirements. So faculties have responsibilities. Faculties within our programs have responsibilities. They are supposed to be role models that demonstrate compassion, excellence, professionalism, and dedication to lifelong learning. And these figures that I have are direct pictures of the program requirements, just so you know the common program requirements. They need to attend to theirs and their fellows and residents' well-being. So their responsibilities of the faculty members are outlined in the common program requirements, and these are them listed here. This happens to be from the fellows, but the same requirements are also in the common program requirements for the residency. And all faculty need to be aware of their obligations as outlined in these program requirements. So they need to demonstrate, they need to be professional, they need to demonstrate commitment to safe, quality, cost-effective, and patient-centered care. They have to have a strong interest in education of the fellows, and et cetera, as you move on. And one of the things that is in here is that they have to pursue faculty development that's designed to enhance their skills at least annually. And one of our responsibilities as program directors is to provide some of these development opportunities for faculty. Programs have to ensure an appropriate environment for education, and they must have a robust process for handling unprofessional behavior. And most of the time, a lot of this process exists within the DIO's office. And that's if you're really having problems, particularly on a professionalism or an abuse type situation, you really need to connect with your DIO, because that's where a lot of the process lives. They must have a confidential reporting system. Again, often this exists within the DIO's office for the entire institution. But the program director really needs to engender trust with all of their learners to really allow them to serve as a resource for the fellows and residents to come to with concerns, and so that they can trust that they will be handled confidentially and appropriately. And as a program director, you have both responsibility and authority. So you have the authority to approve program faculty members for participation. So participation in a program and having a learner with you is not a right, it's a privilege. And the program director decides who gets that privilege. You also have the authority to remove program faculty members from participation in the program at all sites. And you have the authority to remove fellows from supervising interactions and or learning environments that don't meet the standards of the program. So if you are having, these are the things within the program requirements that you can use to work with difficult faculty depending on the situation. So right within the common program requirements, it says that working with a fellow is a privilege that is earned through effective teaching and professional role modeling. And this privilege may be removed by the program director when the standards of clinical learning environment are not met. So this is right within all of the common program requirements of all programs, actually. And so faculty need to understand that. And if you're having trouble with certain faculty, with their ability to educate, or perhaps with their ability to treat learners with the appropriate respect and autonomy, this is where you need to come to with sort of the rules of engagement. It is acceptable to have faculty in a department or a division that don't take part in the educational program. That's okay. So if you have somebody who just isn't up to being able to be part of the program, they don't have to be. But then they don't get to have those people in their operating room, and they don't get to have those people following their patients. So to get to a little bit to the nitty-gritty, the program needs to have a process for discipline, and often this comes really from the DIO's office. And usually they include steps of graded intervention. So usually you have to meet and outline the complaint and set expectations going forward with the faculty members. Sometimes faculty needs to undergo remedial education depending on the infraction. The next step often is to remove learners from a certain faculty or rotation or a schedule for a period of time. And then if this just can't be remediated to the satisfaction of the program director, permanent removal of learners from that faculty's service can be done. And that's usually how the stepwise approach goes. It's very rare to have to get to that point. At our institution, it certainly never happened in my division. It's happened in other departments, certainly I've heard, but it's pretty rare to have to get to that point. Most people at academic institutions really want to be part of the learning situation. And once difficult situations have come to their attention, or complaints about their behavior have come to their attention, they can do things to help remediate those things. In terms of advice to program directors handling difficult situations like this, the first thing is document everything. Because as things go forward, if this ends up with a removal of a faculty member from the program, you need to have all of the interactions, both your interactions with the faculty member, the evaluations of the faculty member, the plans put in place, that all needs to be documented. You want to enlist the help of the DIO's office early, because they often have staff and the DIO themselves who will have dealt with these situations before and will have advice about how to handle things. Within your division, if you have somebody that's being very difficult, you probably will need to have the division chief or perhaps the department chair support in some cases, depending on what we're talking about here. But in general, I would recommend you don't want to do this alone if possible. You really want to have support of the leaders so that people understand what's happening and can help remediate the situation. And some of this is difficult to discuss without having specifics of the situation, but most of the time, if you're going to have a problem with this, it's usually with some sort of unprofessional behavior, or perhaps expectations of hours violations that aren't allowed, or things like that. And setting out specific expectations to the faculty member and giving them remedial opportunities is important, but having your leaders on board with that, with those decisions, is pretty important. And really, most faculty, I believe, will respond to the intervention. I think most of the time when people have situations like this, it's either they're unaware as to how they're being perceived, or there's an issue somewhere that they need help with. And they may need additional help aside from they may be expecting the fellow or resident to do some things that perhaps someone else needs to be helping with. But it's not usually because they're bad people. We don't have a whole lot of bad people that we need to work with. Most of the time, it's a problem that's manifesting for some other reason. And if you get to the bottom of it and help them, you get beyond these problems. But ultimately, the program director is responsible for substantial compliance with the ACG-ME regulations. So ultimately, you're responsible for making sure that the faculty are meeting their obligations. So you can use these regulations as your guide for intervention, and you want to document. Just make sure you have the objective evaluations of the faculty and your documentation of your meetings with them and documentation of the interventions that have taken place, because it's going to be very important as the process moves forward that you have it all documented. And the DIO's office, in my experience, I've not had faculty members, but I've had learners that I've had to go through some of these steps with, and the DIO's office is very, very helpful. And while this may be the first time you're undergoing this problem or having to deal with this problem, it's very likely that it's not the first time the DIO has had to deal with a similar issue. So they will have some good advice for you. With protected time, it's a similar thing. If you go through the program requirements, and Sal went through this, the program director must have a day a week, 20% protected time. If you have both a residency and a fellowship, you need 30% time. And if you have more than 10 learners, you must have an associate program director. And I've outlined in red there, the requirement does not address the source of funding. So that's the problem, right? They say, here's your requirement, but they don't say how you're supposed to pay for it. I can tell you how it works at MCW and a little bit about how the funding works, and I'm sure Misty will go through this, but just in general, Medicare pays direct GME support for salary and fringe benefits of the residents. There's also indirect GME support that goes to the hospital to compensate for the quote-unquote inefficiency of teaching, of being a teaching hospital. At our institution, some of this money for the hospital gets funneled back to the medical school, and then the central funds from the medical school come to the department. A portion of it comes to support education. However, it's not specifically for a certain job description. The department chair has the discretion to support different faculty members for their roles in education. So for example, my support is a reduction in RVU expectation of 5%. However, I'm also 50% VA, and the VA also supports the educational mission. So it's hard to quantify how much time I really have as protected, because I have a whole section of VA time, and it's very valid for me to be spending my VA time doing resident and fellow education duties. However, often it doesn't actually translate into a whole day per week of protected time. Often it's a certain amount of RVU reduction expectation. If you really have no time at all and you're not spending enough time getting the work of the program director done, the site visit may cite this as a problem. And if you're really in a negotiation and you're having trouble getting the time that you actually need to do a good job, this may actually be helpful if it gets cited. However, obviously nobody wants citations in their site review, but this may be, if it ends up as a citation, it may be a way to negotiate for more time. And then finally, if it's really an issue, you need to appoint an APD, and you can have more than one APD. There's no rule about that. Make sure your program coordinator has enough time, and often that's more important. And we'll take questions at the end.
All right. Thank you very much, Kelly. A very difficult topic for anyone who's ever had to deal with that. So maybe we'll get some good questions during the discussion portion.